Medication errors are the most commonly reported type of medical error. And recently, there has been criminalization of medical errors on the part of healthcare personnel. So, medication errors are important for patients and they're important for personnel.
Hi, Julie. Thanks for joining us today. So I just wanted to talk to you about medication safety guideline. And I was wondering what surprised you the most about the guideline when you were updating it?
I think the most surprising thing about the guideline update was the real lack of research on perioperative nursing medication errors. We really need some strong research in that area.
Yeah, for sure. Well, tell us me about what are the biggest risks associated with medications that this guideline addresses?
Yeah, there's really three categories. There's patient risks, of course, and then there is personnel risks of exposure, and then there's also just generalized risks related to storage and those kind of things.
Yeah,
are the big three.
Yeah, so quite a few. What recommendations did you find that were new? And can you talk a little bit about some of the new ones that you added?
Yeah, there were a lot of changes. And of course, that'll vary what you think are most important based on what's going on at your facility. But I think one of the three areas of big change, there was changes in labeling and hazardous medication. And we added a section on recommendation on antibiotic oversight. And those were really some of the three big areas.
What do you think perioperative nurses are going to achieve by using the recommendations in our guideline?
Yeah, I really think perioperative nurses are hoping to achieve the best possible patient care. And that's really the bottom line. We want them to have a safe outcome from any medication use. We don't want the personnel to be exposed, and we want the medications to be stored and used correctly and according to how they're ordered. And that's really, I think, the bottom line for what we want people to get out of this.
Yeah, for sure. Can you discuss just a couple of significant things that changed from the last version of the guideline?
Lisa, there are definitely some big changes in the guideline, and that will depend on what you consider are important at your facility. But I would say the big three changes for me were changes in labeling, changes in hazardous medication use and protection, and also antibiotic oversight recommendation. With labeling, it's really about only putting the expiration date or the beyond use date on the new container that you've transferred the medication into when it's going to expire or pass the beyond use date during the procedure. And then I would say for antibiotic oversight, it really is about ensuring that your therapeutic and pharmaceutics committees at your facility have oversight of prophylactic use of antibiotics in the OR, such as in irrigation or an hour before the procedure for IVs and those things. And then lastly, in hazardous medication use, there was a ton of changes, but I would say one of the big ones was considering whether you're going to use a respiratory protection device or a surgical mask when you're in the presence of hazardous medication.
Hey, Julie, can you think of a time in practice that you needed to use the medication safety guideline or wish you had it in a situation?
Yes, I'm so glad you asked that question. So maybe about 10 years ago, I was involved in a hazardous medication spill. There was a spill in my room when we were doing a HIPEC procedure. And I really, really wish we would have had the wonderful guidance that is currently in the guideline about how to manage spills and best practices for protecting yourself when they're and your teammates in the room when there is a spill.
Yeah, that's so true. And I remember one time I had a bunch of medication that I was going to have to open and, put it on the field. And I was like, oh, I don't know, how am I going to handle all of this? And so the guideline was there, and it walks you step by step through how to open different vials, how to label things. So sometimes, you need that guidance in the moment. So it was great to have the reference to go to.
That's wonderful.
Julie, thanks for joining today and talking about medication safety. I know our members are going to get so much out of this discussion, and we appreciate you being here.